Mpox, formerly referred to as Monkeypox, disease, recognition, and understanding. A brief illustrative review of the literature. Colorized transmission electron micrograph of Mpox virus particles in teal, found within an infected cell in brown, cultured in the laboratory. Umbilicated Mpox vesicles at day 4 of infection. Umbilicated vesicle on the lip, day 4 of Mpox infection. Pediatric image of the clinical presentation of the Mpox rash. The Monkeypox virus is part of the orthopox virus genus, which also includes variola virus, vaccinia virus, and cowpox virus. It is the cause of Mpox disease. Mpox is a relatively mild exanthematous disease observed in monkeys and other mammals, including human males and females. Although clinically similar to smallpox, it is not so potentially fatal, being transmissible to human beings. Comparative schematic structure of Mpox viral structure and scale. Membranes are and membrane-bound proteins are purple, capsids are in dark blue, and genomes and nucleoid-associated proteins are in turquoise. Transmission of human monkeypox. In endemic countries, spillover events occur from zoonotic animal reservoirs into humans, potentially leading to limited outbreaks, usually facilitated by close human contact. Outbreaks can also occur in non-endemic regions through introduction of the virus via human travel or importation of animals harboring the virus. Subsequent human-to-human transmission can then occur via household contacts and via other close contacts. Clinical protocols and infection control during monkeypox outbreaks. Recognizing the clinical presentation and having a high index of suspicion are crucial for identifying potential cases. Rapid confirmation through testing and isolation of individuals with suspected or confirmed disease are necessary. These actions should be taken alongside notification of public health authorities for contact tracing and other components of the public health response. Although treatment for monkeypox infection is primarily supportive, antiviral agents and immune therapies could be considered for individuals with moderate to severe symptoms or who are at a high risk for progression to severe disease. Vaccinating close contacts with high-risk exposures and at-risk individuals is also important for interrupting transmission chains and containing monkeypox outbreaks. Appropriate personal protective equipment for medical settings consists of gown, gloves, a fit-tested N95 or equivalent, and eye protection. Monkeypox virus infection can have significant impacts on multiple organ systems in the host, including the protective barriers of skin and mucosal surfaces, lymphatics, lungs, and gastrointestinal tract. Skin exfoliation can be significant, and inflammation of the airway and bronchopneumonia can lead to restricted air intake and diminished willingness and/or ability to ingest food and fluids. In rare instances, monkeypox can lead to sepsis. Definition of terms. Macule, a flat, distinct, discolored area of skin less than 1 centimeter wide that does not involve any change in the thickness or texture of the skin. Papule, a circumscribed solid elevation of skin with no visible fluid, varying in size from a pinhead to less than 10 millimeters in diameter at the widest point. Vesicle, a circumscribed fluid-containing epidermal elevation, generally considered less than 10 millimeters in diameter at the widest point. Pustule, a small elevation of the skin containing cloudy or purulent material, usually consisting of necrotic inflammatory cells. Scab, a dry protective crust formed by a combination of blood, pus, serum, or a combination of various such elements over a lesion during the process of healing. Stages of Mpox lesions illustration. Symmetrical maculopapular rash of the torso, back, and buttocks. Left. Symmetrical erythematous maculopapular rash on back and upper arms with areas of confluent erythema. Right. Right tonsillar enlargement with an overlying pustular lesion and yellow-green exudate with slight deviation of the uvula. Mpox lesions on male pudendum. Cervical lymphadenopathy in a child with Mpox. Mpox Identify, Isolate, Inform Mpox Information poster concerning disease exposure, management, signs and symptoms, isolation, and reporting to hospitals and governmental health authorities for healthcare practitioners. Exposure. Contact with persons with suspected or confirmed monkeypox, or contact with persons with rash consistent with monkeypox, or multiple or anonymous sexual partners, or contact with animals with suspected monkeypox, or travel within 21 days to a region with endemic monkeypox. Management involves consideration of quarantine, vaccination, and education of exposed people as to incubation period, signs and symptoms recognition, and transmission prevention. Signs and symptoms: prodromal phase, fever, chills, lymphadenopathy, backache, myalgia, sore throat, asthenia, malaise, enanthem, cough. Exanthem rash follows in 1 to 4 days. Progression from macular to papular to vesicular to pustular to crust and to scarring. All in same stage of development within a body region. Typically manifests initially in genital-anal region, followed by face, palms, and soles. Often becomes generalized and not attributable to other diagnoses. Isolation involves donning PPE, N95 respirator or equivalent, gloves, gown and eye shield protection, and shoe covers. Placement of surgical mask on patient for source control. Covering of the patient's lesions and rashes. Disinfection of patients' and healthcare providers' clothing. Sanitizing bed sheets that have come into contact with infectious patients. Placing the patient in airborne infection isolation. And initiation of symptomatic and disease-specific treatments. Information involves hospital infection prevention protocol dissemination, local and state health department reporting, as well as national government health agency reporting. New presentations coming soon. Thanks for watching. Thank you, subscribers.